is falling short on the side of professionals in that regard?
Well, maybe lack of skill, but it's not something that, should occur frequently. Yes, maybe lack of skill on maybe something went wrong.
All right, that leads me to Dr. Anas. We're talking about maternal mortality. This is dear to my heart because, like already stated, the figures are there. After India, Nigeria is next in terms of maternal mortality and neonatal deaths. This is completely avoidable. Yeah. What can we do, to change these figures? I mean, bringing life to the world should be as safe as possible. So what can be done? Or what is being done?
Yes, thank you very much. It is indeed very sad that Nigeria still contributes significantly to death of mothers as a result of pregnancy, childbirth, and immediately after delivery. And most of these are more than 90% preventable, and we can do it. So a lot of efforts have been put in place to ensure that we have safe delivery. So it does not just start from delivery. Let me start from access to sexual and reproductive health services for women and girls. A pregnancy should be a thing of joy, and it should be planned before you go into it. So that aspect, we have to manage it well. We have to provide information. We have to provide the commodities to allow women to make informed choices, to decide when they want to be pregnant and the number of children that they want to have, and even how to have the children. People are opting for an even cesarean section in most countries. So those aspects have to be handled well. And when a woman is pregnant, she must have access to antenatal care services. Minimum of 8 we are recommending in a facility nearby. And when we say nearby, you're talking about primary health care facilities, be it government-owned or privately owned. She must have access to it, where she will go through the general screening, antenatal clinic talk, awareness creation, information, and she's well empowered on how to take care of herself and also the baby. And then the woman must also come back to a facility and be delivered by a skilled birth attendant. A lot of people will say, well, people deliver at home in developed countries and safely. Yes, where you have access to skilled birth attendant, it can happen. So, and then immediately after delivery, the care also continues postpartum because a lot of women die. So what can we do? And I can say that efforts are ongoing, especially under President Bola Ahmed Tinubu. There's an initiative directly under my office to accelerate reduction of maternal death. Okay. That must happen. And it needs collective efforts, not only government, private sectors, and different players. Not only the woman and her family, but also a total community, religious leaders. Because if you look at the social determinants, the drivers of maternal death, they are multifaceted. They are beyond the health sector. Because decision has to be taken that the woman should attend antenatal clinic. Okay. Decision has to be taken that she must deliver at the health facility by a skilled birth attendant. And this is a totality of a family and community. So we must address the underlying causes, the determinants. And I have been on an advocacy to even state government, meeting with religious leaders, policy makers, to ensure that they own it, they understand that this is a problem in our community, and ensure that women have access to such services. Because the major cost are the delays even in the decision making, to leave the home and go to the facilities. And then she has talked about accessibility, transportation. How do you transport the woman to the facilities? You need to carry her to the facilities. There is a vehicle that needs to carry her to the facility. Those are not there. Efforts are ongoing to ensure that we have emergency transport services that conveys, and even at the point, at the facility level, it could be an emergency. In fact, that is the crux of the matter, where most women die. You can find a woman that have had all her antenatal clinic, but at the point of delivery, when it is an emergency, she dies. Most common cause of dying is bleeding, hemorrhage. It's just like opening a tap and the blood flows. She goes into shock and dies. So that must be addressed at the facility immediately. The second one is hypertension, which leads to pre-eclampsia, and it could be pre-eclampsia. And the woman will just die within a twinkle of an eye. And then before you start talking about infection and other things. So emergency obstetric care must be available and must be delivered by skilled birth attendant. And there must be linkage, if it is a primary facilities, to refer to the next level of care if they cannot.
Now, what are some of the barriers to safe Motherhood Day, motherhood in Nigeria? What are the challenges?
That's a beautiful question. I was so happy. I was praying that you would give me that question. And by the way, I'm not a doctor. I am Mrs. Chika.
Okay.
Yeah.
Okay.
So, education.
Education.
Education is such a critical part. I look at education as a vaccine. It's only an educated woman that knows that she needs to visit the health facility. It's only an educated family that finds the value of making sure that all the drugs that she needs to take to prepare herself for delivery, that she will take it. It's only an educated father that knows, because nobody wants their wife to die. If you look at it very critically, the man doesn't want his wife to die. The woman herself doesn't want to die. She doesn't want her children to die. But what happens is that they're not educated enough to know the value of that visitation to the health facility, the drugs that they need to take, how many times they need to visit the facility. Right now, as we speak in Nigeria, we have the highest zero dose in the whole world. 2.3 million children have not taken one vaccine. Ask yourself, because we had to do an analysis and a research as CSOs. Is it that the mothers hate their children? It's not possible. So what is the barrier? They do not believe what they have heard because they're not educated enough. That education.
Let's just quickly get to Dr. Ario so we can round up this conversation. We're actually out of time, but you could just take a minute to tell us about this motherhood issue. She's mentioning some challenges. Could you just give us a bit and then we'll wrap up?
I'm still going to emphasize on the education. Yes, because she was talking about the Bill of Rights and, the fact that even at the hospital, when patients are asking questions, they are shut down, kind of, yes.
So why do doctors do that?
It's still the fact, education is still part of it.
On the part of the doctors too?
Yes, because like, I usually, when I ask a patient, okay, so what medications have you taken? They say they're just given an injection. They don't know the name of the injection. It actually gets me upset. And usually I tell them that it's your body. You're supposed to know what you are being given and what is being injected into you. So it's there's kind of this belief that patients should not know what they are being given, especially I'm sorry to say with private establishments.
All right.
Sometimes they give you your drug in an envelope and they
just so that you don't go and put it somewhere else.
All right, Dr. Ario, thank you so much. Let's go to Lagos quickly. In 30 seconds, Dr. Leke Oshuneyi, in 30 seconds, just round up your thoughts on what can be done for this healthcare delivery system in Nigeria. Just 30 seconds.
A plan that is agreed by all stakeholders. It would include education, advocacy, planning, coordination by all the agencies, primary health care, National Health Insurance Authority, the Federal Ministry of Health, and all the parastatals concerned with health. A very robust IT architecture that can manage perhaps 500 million people so that we can scale it. Provision of funds, adherence to the Abuja Declaration, which states that 15% of the budget of a country should go towards healthcare. Now we have 4.6%. We should try to reach the 15% mark, because other countries that are not as affluent are managing to reach that mark.
So much, Dr. Oshuneyi, Chairman, Health and Managed Care Association of Nigeria, and also Chairman of HMOs in Nigeria. Thank you so much for your thoughts on the program this morning. We do appreciate you. Of course, Dr. Salma Ibrahim Anna, Special Advisor to the President in Health. Thank you for being a part of the conversation. Dr. Bola Ario, Consultant, Family Physician, AMI and Nawa Hospital of Sokoro. Always a pleasure to have you. And of course, Chika Kemiofo. Thank you so much, the worry girl, for being very real with us this morning. So, of course, that's Good Morning Nigeria today. Many thanks for watching. I'm Henry John. Enjoy your weekend.
And I'm Ademola Adeye. Thanks for joining us. Bye for now.